Hello, in this video, I'm going to talk about sensory adaptation. Sensory adaptation is a decrease in the strength of a sensation during a prolonged stimulus. So, a stimulus could be like a smell in the air, it could be the temperature of the air around you, it could be like the feeling of your shoe on your foot, it could be pain. Well, pain, I suppose, would be the sensation, but it could be something causing pain. So a stimulus would be just anything in our internal or external environment that is causing sensory receptors to detect that information and send it back to the central nervous system. Adaptation is a characteristic of most sensory receptors, not all. So we have different types of sensory receptors, some that are more likely to adapt and others that are not. Okay, so one type or one overarching category would be rapidly adapting, also called phasic receptors. So these are receptors that adapt to a stimulus very quickly. Okay, so they're specialized for signaling changes in stimuli, and their intention is not to just constantly send the same signal over and over and over about a stimulus. Rather, they slow down and stop sending that signal to alert us that stimulus is there. So that would be like pressure, touch, and olfaction, just as a few examples. Olfaction being our sense of smell. So if we look at our picture here, you see in the very top, that red line is showing a stimulus. So you can see that we're saying the stimulus, after it has that steep increase, then the stimulus is continuing. Okay, so maybe that's like the smell of cookies in the house. There's cookies baking in the house. And so that stimulus, that smell in the air, is continuing. It's not dissipating at all. It's going on exactly the same. So the rapidly adapting sensors would be what we're seeing in the bottom here. So rapidly adapting or phasic, it basically we're seeing a lot of signals being sent initially, like you walk into the house from outside and you're hit with that smell, and your olfactory receptors will send a bunch of signals to the brain saying, hey, alert, alert, here is the stimulus that we're detecting right now. Your brain will match what that the experience of that smell, the sensory information that it's taking in against past experiences. You might decide it's a good smell like cookies, or might be a bad smell like garbage, or who knows what. But you'll compare that smell against your past experiences, and that's it. Now you adjust to that smell. You stay in the house and you adjust to that smell. And that adjustment is because the rapidly adapting receptors stop sending the signals. So we'll still send a signal every so often, but it's way further, way more spaced out. But it's sort of like the brain is still kind of keeping tabs on that stimulus and what's going on, but it's way more spaced out. So they're really meant to help you detect changes in your environment or in your internal environment. So it helps you detect the difference between the smell outside and the smell in the house, but you don't keep experiencing that sensation all the time. You're not aware of that sensation all the time. Now, slowly adapting receptors, also called tonic receptors, are what we're seeing in that top green box underneath where we see the stimulus. So those are sensors that are very, very slow to adapt or maybe don't adapt at all. So they adapt slowly and continue to trigger nerve impulses as long as the stimulus persists. So examples of that would be like pain, especially body position. So we're constantly sending information to the brain about our position, like via proprioceptors and other types of receptors. Chemical composition of the blood, like we need to know how many hydrogen ions are in the blood, as an example. So things that we need to constantly be keeping track of do not adapt. So those are slowly adapting. That's why if there's something causing you pain, you're going to continue to feel that pain until whatever is causing the pain resolves. So we don't just feel the initial pain and then stop feeling it, sort of like how we smell the cookies baking and then we kind of stop smelling it. That doesn't stop with something like pain. And that's important. There's a reason for that. And that's because if we're experiencing pain, it's because something is damaging our tissue, something is being injured. So that's an alarm. The pain is an alarm, it's an alert that something's going on. And so we don't want that to adapt. We want to continue to hear the fire alarm going off saying, hey, something's wrong. We need to solve whatever this problem is so that we stop doing damage to that tissue. All right. Thank you for watching.